Mr. Otieno,
Yes.
tell us, how did you get in contact with Faraja Cancer Support and how have you benefited?
Okay, we were in Kenyatta National Hospital for about 1 year. That's where we met the Faraja. And from there, we were supposed to do radiotherapy, so they had to take us to the HCG Cancer Center.
Yes.
Yeah. So that's where we are still up to now. Yeah.
So your daughter, when did you find out that she has cancer?
It was back in 2023.
Yes.
Yeah. She was staying home with her mom.
Where is this?
That is in Siaya,
Okay.
Siaya County, a place called Game.
Game.
Yes.
That's where I'm from also, huh?
Okay. Yeah, Game Sirembe. So that's where there was a small car, something like a pimple here. So we had to go to dispensary to check out what is this. So after there, we were referred to Bondo Sub-County Hospital.
Yes.
So that's where they do the first surgery. And then they took the sample there.
Yeah.
Okay, they took it to how do you call it, to lab.
Yeah.
Then after 2 months, that's where we found out it was a cancer.
Okay.
Yeah.
And how's
so
the
the journey
treatment?
started from there.
And how long ago was that?
That was 2023.
2023.
Yes.
Okay. Tanya, do you want to say something? How's the cancer treatment coming along? How are you feeling?
I'm feeling good. I'm fine. And there's no challenges right now, but when I am given chemotherapy, that's where the challenges come from. But right now, I'm fine.
Okay. What kind of challenges do you get?
So when I am in chemotherapy, I get some challenges like sore throat.
Okay.
And vomiting and weakness. You cannot eat, a loss of appetite.
Yes.
Yes.
Okay. And how many times do you go for chemo?
I go 6 cycles. Yes.
So 6 cycles is once every...
What? No. What? Like, you have given 1 cycle, then they look how you are going. When you are good, you have gotten the strength, they give you the second one.
Okay.
Yes.
All right. Dr. Robert Kimutai also in studio. Good morning.
Good morning, Nick.
How are you?
I'm fine, thank you.
Yes. Where are you based?
I am based at MP Shah Hospital, and thank you to Royal Media who are our partner, and Faraja themselves. At MP Shah we have our ongoing cancer program.
Maybe tell me about the statistics of childhood cancer.
Okay, so childhood cancer globally, we have about 400,000 new cases every year. And when you look at the Kenyan statistics, the number is about 3,000 to 3,200 new cases per year.
Yes.
So what you see mostly out of all those cancers, what we see most commonly is the blood cancers, which forms about 1/3 of that 3,000 new cases, which is, let's say, about 1,000 new cases. And what you see about the cancer that Tanya is describing, those are generally a bit more rare compared to the other cancers.
Okay. And are we having a lot of cases that are undiagnosed?
Indeed, I think that is really the whole point of this September Childhood Cancer Awareness Month. And working together, we want to raise awareness to everybody that a lot of times these cancer cases may be, they may be undiagnosed. People may not be aware about them. They may be misdiagnosed. And sometimes what ends up happening is that patients present late to the healthcare system because it took a very long time for them to eventually identify that it was cancer.
So what would you tell a parent? Because I can't imagine, thinking of my child having cancer. What are the symptoms to look out for? And let's start with the symptoms.
Yes, indeed. I think like Tanya's case, there was a new lump which grew from, it was not there before. So
is there a specific place the lump grows?
any new lump in the body, we have to really think about cancer as one of the possibilities, especially when it is continuing to grow and it is not getting treated. It is not a common, like swelling that is known. Then we have to think about that as a possibility. The other thing that we say generally is, children are children. They should really be active, playing, eating. So if you see any unexplained, fevers, the child is not feeding, they are losing weight, they are having sweats at night, maybe you see swellings around lumps in the neck, which we normally call lymph nodes. If you see symptoms like generally loss of appetite, which is not explained, then we have to think about cancer. But let's remember that cancer can start any part of the body. Another one which is missed a lot of times is the brain cancers, where sometimes you find a child starts to develop new symptoms like loss of balance. They're not performing well in school when this child was performing well, attending school well, and they get headaches. In the morning you see they have vomiting. We've already talked about lumps, which in the case of Tanya started in the chest, but it can also start in the abdomen. Another common thing is sometimes children, especially around the teenage years, they are playing football, and what happens next, they get hit, a swelling develops, and they attribute that to their playing or to the trauma. But eventually the swelling doesn't, a normal swelling would go down in a short time. Yeah, but this continues to grow and wrongly continues getting attributed to that, and patients end up delaying. At the end of the day, when you do the scans, you find that it was actually bone cancer or a soft tissue cancer which was developing. So I think what we're just saying to parents know their children best, and they have, let's call it, the best instincts about when the child is not doing well. If the child is not doing well, has new symptoms, they are unexplained, then recognize this early, get medical advice, and be seen by the doctor. Sometimes parents have to kind of advocate for their own children, because sometimes doctors, because they are seeing so many other conditions, may not think about cancer. And indeed, cancer is rare, and it's not really the first things that you think about. But if it's not explained, then we really want them to maybe ask, can we do more investigations and all that.
All right, let's go back to Mr. Tieno, who will tell us how was it like the first time now you found out that Tanya has cancer?
Okay, the first time we knew it. Okay, the first time we knew it was cancer. As a family, it was not easy to accept. But eventually, as the time goes, we had to accept the journey. Then we start the journey as a family. It was the challenges were many, like financial and whatever. Yeah. So the child was at home, so he had to come to Nairobi because I was living here. So it was easier to get treatment from here because he will be staying with me here. Yeah. So from there we went to Kenyatta. She got admitted to Kenyatta. She stayed there in the ward like 1 year, the whole of 2024.
Wow.
Yeah. So the chemotherapy. Then after that, they did surgery. Yeah.
So what kind of support have you gotten so far from Faraja?
Faraja, the ones who are paying for me the radiotherapy at SGG's Cancer Center in Parkland there. Yes, so they are the ones who are paying for me the sessions.
What would you advise Kenyan parents?
Okay, what I would like to say. This cancer disease is a bit challenging. Yeah, it's a bit challenging, but when you had your child as a cancer, you just have to accept. You have to accept, and you seek for medications. Yeah, because like back in home there, people don't believe much on it is a cancer, it's a disease. People see it like something else.
Like what?
Like maybe, how do you call it? I've forgotten the name, but you know. Yeah.
What, like witchcraft or something?
Yeah, witchcraft. Maybe bad luck. Maybe, something like that. Maybe you did something bad Yeah.
But it's a backward way of thinking, so I also understand how people in the village are.
Yeah.
So what did you do to the journey towards accepting? Did you talk to someone, or you just decided?
Back in the hospital, back the Kenyatta, they have a counseling center.
Oh, okay.
So they took us through the process with the kid.
Yes.
So eventually we accepted.
Okay.
Yeah, we accepted and we started the journey.
Have you also counseled the people in the village and told them this? And told them, wacha kufikiria namna hii.
I have not get that opportunity. Yeah.
So if you're catching in with us right now, this Saturday we've got the Be Bold, Be Gold. It's all about the work that the Faraja Cancer Support Trust has been doing, and this year in partnership with the Royal Media Services, We Care. And what they do is help children who are suffering or going through, cancer. There's support groups, there's complementary therapy, and the support groups include breast cancer, gynecological cancer, that's ovarian, cervical, uterine, and all of those, prostate cancer. The caregivers are also supported, head and neck, blood cancers, young adults, colorectal cancer, parent support group at Kenyatta National Hospital, gastrointestinal cancer support group. And we want to thank Faraja Cancer Support Trust because there's a lot that goes into supporting these kinds of initiatives.
Childhood cancers are really curable. So I think the perspective and that we tend to hear sometimes comes from the adult, or the narrative that we hear is because of the experience people have had with adults with cancers, because many times it tends to be more, the outcomes are, the survival is less in adults. Maybe 5-year survival may be less than 50%, but many of the childhood cancers are curable, and we're talking about cure rates of about 80 to 90% for childhood cancers. So generally they are curable. So the other thing is that it requires a lot of investment in terms of being able to do specialized tests, specialized imaging, like Otieno and Tanya have mentioned, radiotherapy. So the facilities are many, and therefore this month we also want to just really continue to urge to get that everybody who can chip in to support this. I know one of the biggest players is the government, and we continue to work with the Ministry of Health to see that we can get more things paid for, and so that we are able to treat the children, because we need all this everybody's input basically in this, and I'm happy that they are playing their part. Yes.
Maybe, so how long have you been away from school?
2 years.
What class were you in before you went to hospital?
I was in grade 6.
Grade 6?
Yes.
So now you should be in 8?
Yes.
Wow. When is she going to go back to school?
So we are planning maybe on January. Yeah, next year January.
What have you missed most about school?
Just missed how we learn, we play, with just seeing many people like I was seeing before. Yes.
So, because Dad said you're in hospital for a year, so now that this next year you've just been at home.
No. I was going home, going back to the hospital. I stay a while, then I go home, just like that.
How long would you, like after you left hospital the first time, how long would you stay in hospital when you come to visit?
I just go home once, then when I came back, I go to surgery. I took a long time.
Treatment, what Hatania had is, or has being treated is what we call a solid tumor or solid cancer, and the approach generally we use is to give chemotherapy to try to shrink that tumor, make it easier for the surgeon to actually do the surgery to remove the cancer, because surgery is the key thing. And then we can do radiotherapy. Not all cancers require radiotherapy, and then after the radiotherapy we again give more cycles of chemo, so that they can be able to be cured from the cancer.
And this, so now for her, she stays in hospital for how long?
So it will really depend, because
or each case is independent.
Yes, every case is independent. Like Tanya had mentioned, sometimes you have to monitor for chemotherapy. Sometimes the distance they come from is very far, and it might be just more logistically sometimes better to be near the hospital. But I think one of the important things that Tanya raises is really being able to be a child, being able to play, go to school, and grow like with other children. So we don't want necessarily to have the children within the hospital. And right now, MPSHA and other partners are working towards developing homes which are nearer to the hospital, so that they don't really have to stay in the hospital all through the cycles. They may just be in a home nearer to the hospital, and they go between that home and back to the hospital. So some of those are the things we are working together with, because cancer is a multidisciplinary area. There's a medical aspect and the non-medical aspects, and all of them are equally important.
Maybe you can talk to parents about maybe just going for screening at an early stage, because like you've said, if most kids get treated early, and it's faster and more, because adults, by the time you discover maybe at stage 3, 4, 5. So maybe just talk to parents that, because there's like a stigma around it. No one wants to think of their kid with cancer. Maybe a word of advice.
Yes, indeed. I think fortunately, childhood cancer is rare. But the difference between childhood cancer and adult cancer is childhood cancers tend to be quite aggressive.
Yes.
Which means within a very short time, you move from symptoms to really being very sick. And of course, if nothing is done, then the outcomes tend to be poor or bad.
Yes.
So I think, really coming to your point, we really don't have the similar screening programs that you have in adults, like cervical cancer or breast cancer, So in childhood cancers, we say detect early. That means that when you have these symptoms, make sure, like in Tanya's case, they saw a small lump, which ultimately the parents were proactive. They went to the clinic, and it was a sample was removed and sent to the pathology, and they got feedback about that. So anything that is really, the things I mentioned, really unexplained, one of the things. If you have things, symptoms, again, let me just come back to unusual symptoms, which you like the child is losing balance, or their scores in school are going backwards, or they have things like masses which are just growing, their health is not good. Then, of course, there are many other commoner things that are seen, maybe like an infection and all that. But if that is not responding, then we just have to think about cancer. And so I'm really urging parents that just advocate for your child. The outcomes of cancer in children are good, whether the child comes in late or early, but we prefer, of course, they come early because the chances of cure are better. And a lot of the stigma comes from the association between cancer and fatality, which is very different story in children. It's not the same in adults. So we really encourage them to just accept the diagnosis, like Otieno mentioned. Really need to just accept. And to do that, we go through counseling and demystifying it and talking about it more and more. And the earlier we detect, the better the outcomes.
Cancer is a disease and is curable, like just the doctor said. If you see any unusual symptoms, it's better you go to hospital to check out. Yes.
Okay. So yes, you've heard about Faraja Trust. They've been around since 2010, and their aim is to provide emotional, practical, and healing support to anyone affected by cancer. This weekend there is a walk. Have you attended any of the walks before? Are you going to be part of this one?
Yes, I've attended walks, many activities, playing with children, because we are a family, and the relationship we build is slightly different maybe from what other doctors and their patients build, because we really get to know each other. We work together and do a lot of activities together. And working also, like I said, the non-medical is equally important, because in the medical side we have a lot of things to think about, treatment, the chemos and all these things. So there's a psychosocial support which requires time and requires people who are dedicated to that, and we really appreciate people like Faraja and others who come in to support. Anybody can actually take part, including other school children, everyone generally. I mean, we've seen sometimes school children bring their donations,
yes,
toys and all this, so that they can support this. So everybody can really play a part in the activities that we do this month. and I think we welcome all the support. Just walk in, come to MP Shah and say we'd like to support cancer. Go to Faraja, go to Kenyatta Hospital. You'll always find a role there.
Okay. So as you've heard, they've touched over 30,000 lives of cancer patients and caregivers with so many services, a wide range. There's information for cancer patients and their caregivers. There's complementary therapy that also is supported by Faraja Trust, helping reduce the side effects and restore a sense of control and vitality, therapies, physiotherapy, nutrition, counseling, and all these. So you can hook up with the Faraja Trust Be Bold, Be Gold walk that's happening at Calro this Saturday. 5 kilometer, 10 kilometer, 21 kilometer walk, and let's see how we can help all these kids because this month is Childhood Cancer Awareness Month. Maybe Tanya, you can say something, your last words, as you inspire maybe other children as you look forward to going back to school in January. What are your final words and your thoughts?
For me, I want to encourage those children that have cancer that it doesn't mean if you have cancer it's a death sentence. You can just go to treatment and get well and go back to school. Like for me, when I went to KNH, I find the Faraja teachers and we were taught how to crochet. So when I went back home, I know how to crochet and to color, to draw. Yes.